Hi, everybody, and welcome back to an Invisible and Invisible Illness Awareness Project. Now that we've covered quite in depth what medical racism is, I wanted to go a little bit beyond that. Now, this is actually what my goal was to get into what I'm going to be discussing this week and in the next couple weeks, but I wanted to lay the groundwork for that first. So, first of all, I got into this conversation that led me over to Twitter, and I'm going to get more into that next week. But once I got into Twitter, this person is named Tinu, and she suggested checking out the Med Trauma chat, which is something that has like different themes that they cover. And at one point, the theme was medical racism, and she was the one who led that discussion. So I really wanted to share that with you guys. I love the questions she asked and the whole attitude surrounding it. Unfortunately, I just think it's a shame that it didn't get more attention than it did. So hopefully, by sharing this, we can get some more attention drawn to this conversation. Normally, I would encourage you guys to engage with the discussion in the comments here, but in this case, I would say if you're on Twitter, go ahead and seek out the original conversation and maybe you can revive it. I've discovered just in the few weeks that I've been on Twitter that there are a lot of things going on the internet that I've kind of missed out on because they don't make their way from Twitter over to Facebook or YouTube. So there's definitely a different community over there that can be reached. So if you're active on Twitter and you have a following, consider posting over there and maybe you can help draw some more attention on that end, get more people engaged with this conversation and just kind of revive it. So she begins the conversation saying, to be as inclusive as possible, we're talking about awareness, personal incidents, research, as well as ideas to help reduce medical trauma stemming from racism. All are welcome. Whether or not you personally experience racism when trying to obtain, you can bear witness. Maybe we can find ways to circumvent or even stop it. Question 1. Were you aware of racism as a type of medical trauma before this discussion? If so, how so? So the first person answered, my husband has a service dog and strong meds for IP pain. He has AS. The judgment he faces in the ER. Once told to go to a methadone clinic. It hurts my heart. He endures many bias-motivated hate crimes. Most don't know patients are protected by civil rights. Deserves better. Tinu's answer to question 1. I first became aware through my own experiences, though I second-guessed myself at first. It sounds obvious, but when something is racist, I'm often in denial at first. Someone answered, I know this feeling of self-doubt. It often takes me a few weeks or even a few interactions to really accept when something is off. The stakes are so high when you're seeking medical care that you try to convince yourself it's going okay. Tinu replies that, is it me feeling? It helps if there are other people there or evidence somewhere to corroborate your intuition, although I'm learning to trust mine more. The same person replies again, finding patient spaces, and especially disabled and queer identified patient spaces, has been huge for me in this regard, knowing I'm not alone in my healthcare experiences. Though I've also noticed that racism, ranging from overt to microaggressions, is really prevalent in many patient spaces I've been a part of, which I imagine makes it that much more challenging to find that kind of community support. So yeah, this whole "isn't me" feeling is something very humanizing about this, that I'm so glad she shared this. When it comes to racism today, it's often not so overt that nobody could deny that it's racist. It's more of, going through your own experiences and seeing that other people are not treated the same way. So, of course, it's natural that you would second guess yourself. I second guess myself all the time. So, I appreciate sharing that vulnerability, and I hope that helps other people to empathize a bit more. Tino then has another answer to this question. It amazes me how often I experience a change that didn't happen before any other life change, and doctors will swear it's not the medication. When they raised my gabapentin dose, I gained 20 pounds, and when I ran out and couldn't get a refill, I lost weight too. Someone replies, wow, they wouldn't give you more. They pushed it on me for years, and I said no until an OBGYN said they'd help off-label for menopause symptoms. They just throw them at me and other white people. If you had no reaction to them, I'm calling blatant racism for sure. This is also something I can relate to in the sense that when it comes to anything, if I try it and I see certain changes, I have a suspicion. And if I then change, if I was adding something, I then remove it. If I remove something, I then add it back, and then watch those changes be reversed, then I'm a lot surer that there's a correlation there. And then I repeat that initial change and see the exact same response, then I'm completely sure of what I'm observing. And she's saying this is exactly what's happening to her, but her doctors are not believing it. It doesn't make sense, and I think it really is a flaw in medical training, where doctors see everything very separately and boxed in instead of seeing the picture on a whole and how interconnected every system in your body is. Um, but like this other person says, she's definitely being treated differently than most other patients. So, you look at the bigger picture, you can see that this must have racist motivations. So, somebody else answers, when my daughter was in the NICU, nurses constantly compared her normal name to other babies. A large portion of the other patients were black. So, yeah, of course, if you have like a French name or something, it sounds very elegant, but if you have a name that sounds black, then people don't really respond the same way. So, the same person also adds, there's a higher rate of premature babies born to black mothers, too, and I'd expect racism stress plays a huge role there. Though, interestingly, black premature babies survive prematurity better than white babies, especially girls. There's a NICU term called wimpy white male. Tinu replies, these two are a bit familiar. I decided to put off kids partly because of the first item, but the NICU term is news to me. Then this person replies, we learned about it from the head doc at our NICU, and it was true. There were more black babies there, but the girls, they'd go home before we'd hardly get to know the parents. And the hardest cases were all white males. Being a white female baby case, we were in the middle. That I find really interesting, and I think it comes back to epigenetics in a way where that past trauma already puts you into fight mode. So both the female and black babies are pre-programmed to fight this struggle even before they're born, because this is something that's been passed down from generation to generation. It's already in their genes that they're gonna have to brace themselves to try so much harder just to survive. Question 2. As you likely know, racism isn't just about individual behavior, it's baked into our institutions and culture. What are some examples of institutional medical trauma related to racism? Someone says, I do know that studies show women of color don't get pain relief in childbirth as soon as white women, and the maternal death rate for black women of any SES is shameful. I'm willing to bet it's harder to get day-to-day pain care for women of color as well. Tinu's answer, examples. Hospitals that have policies to call ICE when poor Latino people come in, having Islamophobia as accepted policy, policies to not give people of color certain types of medication specific to Asian people. Their culture isn't often taken into account when treating pain. Any discrimination coded as policy based on skin color is institutional racism. Some of Serena Williams' story with her newborn is due to this. I'm really proud of my more enlightened friends who realize there are all types of racism, causal, institutional. So most people think of racism as people in pointy white hats calling people mean names. It's much more. Someone replies, it's 1,000 paper cuts, microaggressions, missed opportunities. This is another important aspect to acknowledge, that Racism is about so much more than just your personal experiences. And there's a lot of people, when you talk about white privilege, that are like, well, I've had a tough life too, so I don't have any privilege. And they don't realize that it's more than just their own experience. It's about seeing yourself represented, and you know how you're treated when you interact with other people in your community. So, question 3. Have you had personal experiences with medical trauma and racism, institutional, personal, otherwise? Can you share an incident? Please share as much or as little as you like. Hearing your story helps us, but not if it harms you. Tinu's answer: everything to do with the ACA and Medicaid cuts has directly affected me as medical trauma, partly through the lens of racism. First, there's the assumption that there are mostly black people on Medicaid and ACA. Not true. Second, the assumption that we're someone cheating the system when it's so hard to get care or insurance in certain states. Either you can't afford it, or the plan has no doctors, or you can't get on Medicaid in your state because they didn't accept the expansion. That's something that definitely resonates with me. As I mentioned, I was in Houston for a few months and trying to see if I had any chance at getting help there, but since Texas didn't accept the Medicaid expansion, I couldn't get coverage as a low income adult without children unless I was already approved for disability. And then I was able to get some sort of like a local insurance and went to doctors in that network, and they told me there's no way that I'm going to be able to go to the specialist I need to see in their network. So I would have to pay out of pocket to see other specialists. And then, even then, Texas is in the bottom 10 for Medicaid. So I would have almost the worst possible chances of getting approved. So, imagine dealing with this situation and the stakes are stacked against you. And then on top of that, you've also got the racist aspect playing into it. Tinu continues, I started sharing because other people told me about their trauma. It made me feel like I could be brave, that enough of us talked about things that were supposed to be taboo, maybe we could make it more bearable or even change things. But it was harder the first time because despite what my rising Leo makes it seem, I don't always like to draw attention to myself. This kind of attention, I learned, is good trouble. You never know who you might help, sometimes in a huge way. Again, this really resonates with me because I have been sharing my own story the past few years and have been just blown away by the number of people that have said, that sounds exactly like my experience, that so many people are struggling. And I hope that through sharing my experience, I'm helping people, and I'm so glad people like Tino are sharing her own experience. And I'm planning on sharing experiences from a couple other people in the next couple weeks, because the hope is the same as raising awareness about our illnesses. If people are aware of the situation, they're a lot more likely to empathize with it and do something to help better the situation. But if they've never heard of it, obviously it's not going to be on their radar. If they're looking to do good, they have to know you're out there first. Tino continues, self-care is paramount. If you feel like you can share, if you feel safe letting us in a bit, we really want to hear what it's like for you. There's this prevalent myth that black people want racist things to happen to us so that we can prove racism is real. Not true. As with sexism, we've had all the proof we'd ever need for centuries. If this was about proof, it would be over. What we want is for racism to stop. Period. I hate it when things turn out to be racist. I hope it's anything else. Yes, there are people who leap to that conclusion too much. It's not without basis, though, because that means someone looked at me and decided something against me before I even have a chance to represent myself. This reminds me of something I saw a while back where everybody was explaining white privilege, and you kept getting this backlash from it. And finally someone said, look, you guys have explained it every way imaginable. It's not that they don't get it, it's that they just don't want to get it. And the same way Tina's saying, the proof is there. The The proof is not the issue. I mean, it's very obvious if you open your eyes and look, but the issue is more that some people just don't want to see. So Tinu continues, I used to report to the admin and the state board blatantly as racism. I seem to have better results now by calling out improper care, the circumstances, and if I can truthfully say, I asked around, and this isn't just a low standard of care. Some are treated this way, some aren't. Things go further if I give them the racism ingredients. They connect the dots and declare racism on their own more often. Or when I follow up, lead them to it, which is also racism, them not taking us at our word when they do so for others. Someone replies, that's so smart, let them discover it. Satisfy that rescue instinct. Thanks for this advice. I'm going to think about how best to apply it to my situation. Maybe after discharge, I don't know if I have the focus, strength to fight for care and dignity at the same time. Again, I think this is a great idea. I think a lot of times if you just say racism or white privilege or anything like that, people sort of shut down. But if you give them all of the elements, they can come to that conclusion on their own, and they might, instead of having this preconceived idea of what it is or isn't, they can come to that conclusion, and they might not even call it the same thing, but at least they'll acknowledge that there's a problem. And I see that it's an issue when you're not taken at your word, but in this case, I think you have to realize that it's going to be harder for someone to take you at your word if they don't have that shared experience, which is why it's so much more effective to describe the experience, because then it puts them in your shoes and allows them to empathize and truly understand, which is, another reason why it's so important to share these stories so that people who don't have these experiences get a look inside this world and go, oh wow, okay, this really is a problem, and of course it would be great if you could be taken at your word, but the thing is you're normally being taken at your word by people who do share that experience. So if you want um, to have empathy from people who don't share that experience, then of course you have to open up and let them into that world. And then once they sort of get a feel for things, they'll be able to take you at your word because they'll have some idea of what that experience is really like without you having to explicitly say it. Someone else replies, but prior to being diagnosed with fibromyalgia, I was told that it was all in my head. As of recently, I was berated by a doctor at a pain clinic. He had an issue due to the fact that I hadn't been there for an appointment in several months. He had no idea that I was trying to get my life sorted out as a newly disabled woman. Tino replies, even if he knew, I bet you money he's not berating other patients who are men or don't have the same shade of skin. Why didn't they call and offer some help instead? This actually reminds me of a conversation I had recently. It was like sort of a group conversation for people of color, and this one woman was saying that she was really struggling, and there was a white woman on the call who was just basically telling her, well, you have to be proactive, you have to do this stuff yourself, no one's going to do it for you, that kind of thing, and instead of offering to help it. And I'm like, what you really need is for somebody to come in and say, look, I'll take some of this burden off of you and I'll do this for you, instead of telling you you need to toughen up and do more when you're sick and you're doing the best you can, but you just don't have the capacity. Someone else answers, I'm currently hospitalized and trying to figure out what, if anything, to do about this. I'm not diabetic, also not overweight, a little fluffy to the eye, sure, but since natives are such high risk for diabetes, I'm being administered preventative glucose injections. Okay, see, that's strange. Like, okay, sure, you can say if natives are at higher risk, then you test for diabetes, but you don't just administer the treatment without any proof that there's a need for it. Question 4. Did you ever report a traumatic incident related to your health that stemmed from racism? What happened? Unfortunately, this question didn't get any answers, but Tina did mention her method for reporting a bit early in the conversation. Question 5. Do you have any ideas about how to combat racism in health? If you've experienced it yourself, what has worked and what hasn't? Tina's answer. Number 1. Bring advocates of multiple backgrounds if you can. Wealthier friends see things missing you didn't know about. No matter what, more people and more witnesses makes it harder to deny you. Another thing that helps is to engage the nurses and other staff if you're more comfortable with, unless of course they participate in the abuse. Nurses have secrets and tips and inside info. Question 5. Document everything that happens. Little details sometimes validate your stories in ways you can't predict. If you can, use a lawyer. They take you more seriously. Report to multiple places. In a hospital, the administration is a good place to start, but if racism is institutional, you may be dismissed. If somebody answers, use privilege to support other voices. If possible, offer to accompany people if asked, but don't speak for them. Simply let your presence make medical practitioners less likely to dismiss them. Almost everyone benefits from a witness, not just male OBGYNs having nurse present. This brings up another good point. A lot of times, if you have a white person and a person of color, the person you're speaking to will address the white person and kind of ignore the person of color. But if the person of color is the patient, obviously they're the one who should be doing the talking. If you have a friend or somebody with you, of course they can add something if they've noticed something from another perspective, but the patient should be the main one talking. And so definitely don't go along to do the talking for them. Just, quietly be present, and that itself is already making a difference. Question 6. What not to do is harder. In my mind, don't go it alone. Don't wait to report. I've learned not to give up if a direct report of racism falls through. If they're being racist, they might also be salty elsewhere. You might report to people who don't care. Tino answers, yes, definitely there's a racial aspect. I've been profiled at hospitals as a drug addict too many times. Refused treatment, given the wrong treatment, mistreated before surgeries, not enough room to list the indignities. Occasionally, wealth privilege or class privilege or the fact that I sound respectable or know who to harass has been a partial sheet. But the extra hoops I have to jump through are thefts of my time and energy. I mean, of all things, a drug addict, me, who quits things like coffee or soda or meat or salt for years just to see how I feel, it makes my friends laugh because I wouldn't even try weed until I was 35. Question 7. Despite the statistical evidence and the testimony of survivors, many people don't believe the health crisis of medical trauma due to racism. Please share an incident you experienced or research you've encountered. Unfortunately, no answers to that one, but we do have experiences shared as answers to the other questions. Question 8. How can we be more supportive of medical trauma survivors? How do our actions need to differ when the trauma is complicated by racism? Tino answers, probably obvious to some, but believe us. Believe that racism exists. That sometimes it may be minor, but it's one of 1,000 minor things that day or week. Amplify our stories and voices. If you want to retell our stories, credit and acknowledge us. White allies, speak out when you witness things. Back us up if you see something happen. Sometimes, yeah, I saw that is the difference between us getting kicked out and everyone around us rallying. Again, I'm so glad that she addressed this point and, sort of gives people a guide of what to do. A lot of people are like, well, I'm listening, but what do I do with this information? So I'm really glad, she goes into saying concretely what can be done. How can you help? What not to do? What should you do? Someone else says, learn what incidents of medical racism may look like so that you are aware when they're happening. Again, completely agree with all of this. I'm so glad this is out there. I think this is very important information, very important questions to ask. But unfortunately, this particular thread didn't get the attention that it deserved. So again, I'm hoping that putting this out here will help revive the conversation. Of course, you can comment here, but like I said, if you're on Twitter, definitely go pull this up and comment there too. Don't forget to thumbs up, subscribe, share, all that good stuff. If you would like to help contribute to subtitles, I would definitely appreciate that too. Still got my Patreon account up, and t-shirts in the Teespring shop for whoever's interested. And I will see you guys next week.